And now we turn to Healthcare 4.0, where intelligence and automation create systems that think, analyze, and learn. This panel brings together leaders that are at the forefront of AI, robotics, and data-driven care. Please welcome Dr. Pascal Haber, CEO of Cleveland Clinic Abu Dhabi, Hein CEO of Mediclinic Middle East, Joseph Hazel, Group CEO of Apex Health, Marwan Abdulaziz Janahi, Senior Vice President of Dubai Science Park, and your moderator, Dr. Richard Jenkins, Chief Medical Officer at PwC Middle East. Welcome to our speakers.
Thank you. Welcome, panelists. For the next 20 minutes, we're going to explore how AI, automation, digital and robotics can support the transformation of healthcare, both in the region and I think wider, how it can enhance the patient experience, and how it can drive outcomes and improve the outcomes that we deliver to our populations. I'm going to jump straight to you, Hein, if I may. So, Mediclinic, major healthcare provider, you're operating over multiple facilities across the region. Can you tell us how you're using automation and digital to optimize your systems? How do you use it to drive efficiency? And how do you use it to deliver consistent, high-quality care for your patients?
Thank you, Richard. It's a pleasure to be here today. Thank you, Forbes. I think first and foremost for us, the important thing is to do it in a responsible way. When we look at AI, very important not to go too fast, but equally important not to go too slow, because you will be left behind. So making sure the right systems are in place, properly testing new AI, making sure things are customized for this region and for the population of this region, and not just based on, let's say, a US population base is a key thing for us. And a second important thing for us is we focus on challenges to be solved. Quite often you find vendors coming to you with bright new ideas, and then in the end it becomes a solution looking for a problem. So it's very important that we look where can we improve the quality of care, how can we make things more efficient, how can we give more time back to the doctor. So our mindset and approach focuses on the admin side first, making sure that we take away the admin burden. Two areas there, of course. You've got the admin burden on the doctor and the clinicians, really freeing up their space so that they have more time to focus quality time with the patient. And then on the other side, you've got the more revenue cycle management, patient administration services that we all know about. I mean, we employ 2,500 administrative personnel only. So that is an area, if you could look at reducing that, you can certainly focus more on the patient care. So concrete use cases for us, 5 areas I'll briefly refer to. These aren't unique to Mediclinic, I have to say. We all love to think so, but it's not. They're all in varying stages of pilots or implementation, some of them quite mature. The one is radiology, of course, helping radiologists to read things quicker, to identify areas, to triage scans. In primary care, of course, helping patients to answer some questionnaires before. This is in a pilot stage, of course, taking information from the EHR, and therefore, in the end, the doctor's got a 90% probability of what's wrong with the patient by the time they see the patient. Now that allows for more time with the patient, more empathy, more focus. So very important. The third one is no-show predictions. Patients often want to come and see us earlier. So we've got models running on individuals. So we will know that Dr. Richard Jenkins has got a low probability of coming on a Friday afternoon at 2 p.m. The model factors in things like your past behavior, but also nationality, all kinds of interesting things, time of the week, etc. And then, of course, the ambient AI, giving more time back to the doctor, clinical documentation, automated, that's a key area that we're in a good phase in terms of the pilot. And last but not least, the revenue cycle management automation. So we've got automated coding. E&M is fully automated for the past 3 or 4 years. We're looking at automated eligibility checking that's in place. So wonderful things that's happening there. So for us, the future is giving more time back to the doctor. It's a wonderful, exciting thing about AI. And because over the past 20 years, with the advent of electronic health records, it's become burdensome for clinicians. Good information, but now we've got the opportunity to give the time back and to really focus back on the clinical care. So that's it.
Perfect. Thank you, Hein. So a couple of messages I heard in there. One is we can't just lift and shift things that might work somewhere else in the context to the Middle East and some of the aspects that make this region so exciting. We need to be mindful of. Very pleased to hear that you should have a problem that you then seek a solution, not a solution that you then retrofit a problem, which personally I see a lot, and I think it's very problematic. And also we'll hear lots about clinical care, but the administrative burden I think is very important. So thank you. George, CCAD, we know CCAD for its clinical excellence. In terms of at the bedside with the healthcare professionals, how are you embedding AI and other technologies that support that clinician or that healthcare professional in delivering, to Hein's point, what they want to deliver, empathetic, high-quality care with the patient?
Thank you for your question. So I just want to start by saying that at Cleveland Clinic Abu Dhabi, we're lucky to be part of an AI company with G42 and M42. I think we're the only healthcare system in the world that have an AI company as a partner. So we do have a moral obligation not just to adapt AI algorithm or applications or agents, but to create them. And we feel that we have this moral obligation to creating the future of healthcare using AI. And AI is going to be transformative, and we're already seeing this transformation positively impacting our patients in the hospital, in the outpatient area, in the administrative, on the community, in every aspect of our healthcare delivery, research and innovation, we're seeing an impact of AI. To just name few examples, as of now, we've done over 5,000 colonoscopy assisted with AI, where the diagnosis is increased by at least 20%. So we're increasing the accuracy and the diagnosis of polyps that are precancerous by 20% more. This is one example how it's giving a positive impact. In the background on our electronic medical records, we do have AI algorithms that are running to predict sepsis. As you know, if a patient has sepsis not treated within 2 hours, those patients have a 50% risk of death. We have algorithms to predict DVT, deep venous thrombosis. Those are just few examples how AI is being utilized to keep our patients safe. We're also utilizing AI and computer vision to make sure patients are not at risk of falling when they're getting out of bed. Looking at their pain score, evaluating their vitals, all through computer vision and AI. And I can give you, many examples. Diabetic retinopathy, we talked about, prioritizing MRI scan for strokes, if it's hemorrhagic stroke, if it's ischemic stroke, how those could be addressed. Also, a lot of work on the robotic sides. I'm a robotic surgeon by training. I still practice. And we're seeing more and more now the impact of AI on robotic surgery. How we're leveraging AI for surgical navigation to better define surgical margins for cancer patients. Also, we're utilizing AI to do remote surgery. We've done, transcontinental surgery between the US and Abu Dhabi, the first in the world that was done for prostate cancer ablation of a tumor. So, and those are accelerated, empowered, and augmented utilizing AI. I'm not going to go over all the administrative tasks, but anywhere you think that there is a a repetitive algorithmic task, this is being automated or will be automated in the very near future. And our goal is to have at least 100,000 AI agents running in the background. Things are changing. We used to buy software and try to adapt them to our workflows. Now you can develop one agent for one task and dispose it because it's becoming so cheap to code and to develop application that you don't need to have those applications lasting months or years. You can develop them for just vibe code them or just for small application. And if there is one investment that we are doing right now is making sure that our 6,000 employees at CCAD are all trained and familiar with AI, and to use it in every way possible to have this this feel and try to be very familiar so they can develop their own agent and making sure they automate any repetitive, any algorithmic tasks.
Perfect. Thank you, George. So what I really heard there is whilst we talk about the future, this is really happening now, and it's happening at the bedside now. I particularly like the fact that you referred to the importance of healthcare professionals understanding AI. I think there's just an assumption that healthcare professionals will just get it and use it, but they need training and support. And again, that aspect that you're part of a technology provider, I think we may see more of that in the future as technology becomes so much part of healthcare that they stop being two things and become one thing. Joe, as a growing healthcare group, can you help us understand how you're leveraging AI, technology, data, predictive analytics to support you as a group, both in your journey towards patient excellence and your journey towards business performance excellence, and how those two things may come together?
Yeah, thank you very much indeed, Richard. And it's lovely to be back in Abu Dhabi. So thank you very much indeed to Forbes. Much appreciated. I think, first of all, just for Apex Health, because it's not from Abu Dhabi, we're based in Qatar. We're relatively new. For the last 2.5 years, we've established ourselves as the leading private provider in Qatar. And now we're in 4 different countries now with 8 different hospitals, and we're progressing quite fast. We're very fortunate, though, that we have very strong partners. We have American partners, Cedars-Sinai, so we have a lot of support from the American system. We have a Korean. I noticed it's the state visit today from Korea, so I came in the foyer, and half of Korea seems to come out at the same time. But we have a very strong partnership with Korea, and the number one is Asan Medical there as well. And we have a lot of European partners. So the key thing for us is we'll be able to bring the expertise from all the different providers around. We're not trying to claim that we know what's the best. It's bringing this expertise and this, the leading what they're trialing out, and that we can bring it to Qatar, and then we can take it out from the hub to around the region to support ourselves. So we're very fortunate on that side. And as George was saying, the first thing we did, form a committee. We have 4 pillars. It's the clinical, it's the workforce, it's the financial, and it's the operational. But the first thing we did was understand that people of my age don't necessarily understand the technology. We're not going to use all the features and things. We need to train our workforce to that level. So we've got different grades and different stages as we go through the training to make sure people are ready for what's coming. And by doing the training, gets them all warmed up with all the things coming on. So the whole engagement of your staff was the first thing we did. And then also then it's about making sure that at every level, it's like having the hackathons, it's getting everybody. The use cases actually comes from where the needs are, or the problems to solve, as mentioned. They've got to come from everywhere, from all aspects. You have to have everybody running with the ideas and going through it. And they push it through to a small committee that meets every week, and then we go through and where the use cases can go forward. So then what we do is we then trial out the pilots. So the advantage we have being in lots of different countries, we're under different systems of old systems, whether I'm in Algeria and it's the old French, or it's the Libya, or the Iraq, the old English, etc., or in Qatar. So where we find something works, then we can then spread it quickly around the neighborhood as we go around. And there's lots of different use cases as you go through the whole spectrum. So yes, I think it's some of it is coming from our staff, but again, they say up to 50% of the solutions also come from your embedded systems. So our suppliers, our EHR, our workforce management tools, They are all working. Everybody's working on these solutions. So rather than us just go hunting out there, it's, again, finding the problem we're trying to solve, having the prioritizing of what's really is going to make the biggest difference, and then having that partnership approach with our teams and then with our wider collaboration. But I think some of the things that we all talk about AI, and we bang on about AI for a long period of time at the moment. It's about the combination between our people. It's about other innovations and in the AI, and I think it was mentioned in the first sort of presentations this morning. It is very much about, there's lots of other innovations coming. There's lots of other things. We mustn't get distracted that it's just all about AI. It's a percentage that is supporting. It's supporting our clinicians, and it's that combination of how we use the tools, how do we get the best performance, and what real difference does it make? Every week we have a little chart saying, what difference is it making? And only if it makes a difference do we really push forward with it and then roll it out. So that's one side. The other side is it's about being open and collaborating. So we must be, it's not us coming out as the experts. We must be open for everything. We must create a learning environment which really is accessible and helps people review everything and really be open for opportunities that come from everywhere and from everybody. It is really sort of a bottom-up and from sideways and everywhere, because I think the next 2 years' transformation is enormous. And certain use cases, we've known that it's helped us reduce mortality in some government hospitals in the ICU by 50%. Now, that's not AI. That's AI in combination with the staffing, the training, and equipment, all sorts of different things. So it's a program that's supported overall. But finally, I'd just say that it doesn't solve everything. Sadly, I'm not a clinician, but sadly I had to pass a report from somebody who was told that it's their end-of-life care. It's a second report, and there's sort of no further hope for that patient. And you just wish that AI was going to help someone at the early stages. Maybe it could have detected earlier. Maybe we could have done some kind of practice a little bit quicker and earlier. But you've still got to have the clinical care, the empathy, the process, and you've got to help the patients get the better quality of life for the longer term.
Absolutely, thank you. So I guess a couple of key points that I heard in there. One is we need to listen to the people who are on the shop floor doing the workflows, because they're the ones who know what's really happening. And then all those stakeholders we work with, both the obvious ones that we see every day, but I think, as you said, supply chains and providers and all those other people. And I guess, Marwan, that brings us on nicely to you as somebody who isn't in a healthcare provider role, but within Dubai Science Park. How do you foster those relationships? How do you bring collaboration between innovators, investors, healthcare providers, patients, so that we can pull this together? And as we've all heard, there's not one quick answer to any of this. And how do you drive that collaboration at Dubai Science Park to offer up the opportunities that we may get from the AI and the technology?
Right. Thank you, Richard. This is a good question that kind of sums up, everything that we do. As a community builder, we not only look at having grade A LEED certified buildings. That's something that you do just for one time. But what's more important is what you do inside of the building, the kind of people you attract, the events that we host to connect people. So to answer your question, we work with multi-stakeholders to activate the industry that we have. So we have companies that are in medical devices, pharma, biotech, energy and environment, representing half of the 500 company population that we have. But the other half is startups and companies who are owned by individuals, scientists, and researchers. And what's more important for those companies is really finding a business relationship. I think that's me. Finding a relationship with a supplier, for example, or doing a research with a hospital or a university. So we do that through hosting events, hackathons, facilitating internships. And that's how we basically foster this, collaboration between between both parties, and keeping in mind the triple helix model, if you will, between industry, academia, and government. And we also, in my role, I also look after the higher education under our holding company, and that is in 2 districts: Dubai Knowledge Park and Dubai International Academic City. And between the 2 districts, there are more than 30 universities. For example, Birmingham University, Harriet-Watt, Middlesex, Manchester, etc. And it has roughly 38,000 students, representing 80% of Dubai's student population. So that's a massive body of students. And with my kind of science background, I'm trying to bring academia closer to the industry and have them do projects. And that one of the things that has really helped that is the RDI, which is Research Development and Innovation Grant, that was launched by the Dubai Future Foundation. And this is specifically a grant for PhD professors and PhD students in areas such as AI and many other 7 other areas that has been highlighted as priorities. So that is becoming as a tool for the professors to validate their ideas and try to basically push their ideas from the lab to market.
Perfect. I think that ability to bring in, I think, the student population and the next generation, because as Joe said, there's a generation of us that maybe aren't so naturally aligned to this technology, but the next generation coming through. And then the R&D, the evidence-based, the ability for Dubai, Abu Dhabi, and the UAE to be producing papers and setting standards, I think, is really important. We've got a magic clock that's given us more time all of a sudden. So we've got a minute each. I'm going to ask you as leaders, and this is something that is, as a clinician, very sort of dear to me. With all the talk of AI and automation, how do you as leaders in the field make sure that we are not just going to replace the doctor and the nurse and the pharmacist, but instead we're going to augment them and enhance them, and to your point, Hein, release the time to allow them to care for patients? How do we as leaders make sure that we take that path versus just the technology, strip out the people, put in the tech path? George, we'll just go round.
Sure. I mean, as a clinician, when we went into medical school or went into the healthcare field, our goal is to take care of patients and provide compassionate care. Unfortunately, as we've been progressing through our healthcare journey, we saw a big part of our work is on the administrative tasks. By being able to free the physicians, free the healthcare providers from the administrative task, I think we're going to allow physicians to become physicians again, and nurses to become nurses again, and be able to provide compassionate care. In addition to this, we're going to be able to augment the way they are providing this compassionate care, improving the quality and safety, providing patient companion, virtual patient companions. Imagine a patient sitting in a room to have to, press on the alarm for somebody to come. Now you can have an agentic AI as a virtual patient companion that can answer any questions. Or you can have robotics bringing them a cup of water. So you can see how we can improve the experience of those patients, improve their recovery and their wellness while they're under their care. And this couldn't be more gratifying for healthcare provider, physician, nurses, or anyone working in the healthcare field.
Perfect. Thank you. Hein.
Yes, I'd like to start off by quoting one of the speakers at the IHF conference last week. I thought it was a wonderful quote. She said that AI is not just saving lives, it's saving marriages. And she was referring to physicians, whereby the fact that you're taking some of this burden away from the doctors, allowing them to become real physicians again, and the positive impact that has on them, not only on the patient, but also on the doctors, their work-life balance, all those kind of good things. But coming back to your central question, I don't believe that the patient will allow us to replace the doctor, especially not in this market, the kind of healthcare that we provide. People want the doctor. They want to have that warmth and empathy and somebody that they trust that can verify whatever comes out of the AI. But there's another side to it that I think is quite exciting, and that is in countries where access to care is a major problem. I think there we need to be flexible to say, rather than having no care, maybe it is okay just to have AI care that at least provides you some access to the right test and the right pharmacy drugs and those kind of things.
Agreed. Joseph and Marwan, 30 seconds each.
Yeah, thank you. Very kind for my quick thing. So I think for us, as Hein says, first of all, it's patient choice. There's patient choice, and they will decide where they want to go, and if they want to see the physicians, they can. If there's tools that enable them to get them quicker, they will as well. But my key thing is I think we need to be open-minded. As Shaista said this morning, we don't know where healthcare is going in the future. We're only very early in this journey about the AI, and I think it's going to change so rapidly that our plans now are every year. We used to look at equipment and buy it for 10 years, knowing you could write things off. Now we have to look every year where we're going, what we're building, and how we're doing things. So I think the key thing for me is be open-minded. Let's make sure that we use it as an enabler and helper, but let's also be open to see how everybody else, we're in a small microcosm of the world, let's see how everybody else is using it, and let's make sure that we keep it to patient's choice, that they can choose what is the best for them. Let's keep them in the journey, and I think then we'll go in the right successful path all round.
Yeah, absolutely. And Marwan, final words from you, please.
I'll answer it with a story. So my mother last week did a PET scan. Her doctor advised her to do it. She saw something in her chest that looked suspicious. So she did do the PET scan. The results came out. It was on her app. And she was very worried. She said, I don't know what it is. I will only see my doctor in a week. She's too busy. Can you do something to move the appointment? So I said, why don't we look at the report? So we put the report on ChatGPT, and we said, summarize it in simple words, and how is everything? And it summarized it saying that everything is okay, nothing suspicious, etc. So I told her, don't worry about it. You can see your doctor after a week. And she did. So she walked into the doctor's office saying, I think I'm fine. What do I need to do to feel better? Versus if there was no AI, she would be worried for an entire week, stressed out, high blood pressure. So I think the reason why I'm telling you this story is that AI is empowering patients, which is, I think, more important than anything else.
Absolutely. Please join me in thanking our panelists. Thank you, James.